One other insulin that you can use to treat diabetes is an insulin that you can find in a vial. So this one is a little bit different than using the pens, and it involves a few more pieces of equipment. To use this, you'll need some alcohol, an insulin needle, and then the insulin vial itself. The insulin is normally stored in the refrigerator. However, you can keep this out of the fridge for about 30 days before you need to replace it. And I'll get this out right away. So to use the insulin, the first thing you want to do is you'll notice, take a look at it and make sure that it looks cloudy and white. If you notice any clear liquid or any discoloration, you want to throw it away and get a new vial. Before you start to use it, you want to start by rolling it gently in between your hands. This will warm it up so it's more comfortable when you inject it, and also make sure that everything is well mixed. And the next thing you want to do is take alcohol and wipe off the top of the vial just to make sure that it's clean. Then we're going to take the insulin needle, and we're going to, the first thing you need to do is determine how many units you need to inject. So in my case, I'm going to inject 2 units. And to do that, we take the top of the plunger and make sure that it's at the line for 2 units. And then we'll draw it back first, and we'll take off the cap, and then we'll inject it into the vial and push in the air and turn it upside down and pull back to make sure that you have the 2 units that you need. Oops. And now the insulin is ready to inject. So the next thing you need to do, you can inject in the back of the arm, in the abdomen, or in the thigh. So for this case, I'm going to inject in the abdomen. That is generally the preferred site. It's very easy to access, and it's also, the insulin is better absorbed from this site. So to do this, first thing you need to do is clean off the site, just a little bit of alcohol, and then make sure it has a little bit of time to dry, because otherwise if you inject right away, the alcohol will cause a little bit of stinging. Then once you're ready to go, take about 1 inch of skin and pinch, and then hold the needle, and you're going to want to inject at a 90-degree angle, and you go quickly and all the way up to the hilt of the needle. And then you can push in, hold for about 5 seconds, and remove the needle straight out and let go of the pinch. And you don't want to rub the site at all, because that will change how quickly the insulin is absorbed from your body. Then you can clean again some alcohol. Alright, and then you can recap the needle. And this needle can be used again for about 2 to 3 times. Again, these needles are lubricated, so they inject easily. So if you use them for more than 2 or 3 times, it can start to kind of stick when you inject it and can cause a little bit of discomfort. So after that point, you need to get a new needle.